Hello and welcome to Ask the Expert. From medical questions to questions about surgery or just debunking myths, there are numerous medical questions we've set out to answer for you. For the past several years, 7 News, in partnership with Bon Secours St. Francis, has been getting answers to your questions. From the simple questions like how to get better sleep to the more complicated ones concerning cancer and screenings. This is 7 News' Ask the Expert. Let's take a look.
One of the more alarming forms of heart disease is called heart failure.
Heart failure happens when the heart cannot pump enough blood and oxygen to support other organs in your body. Dr. Jeffrey Sinfield is a cardiologist at Bon Secours St. Francis.
So you have symptoms such as shortness of breath or leg swelling, lethargy, and it can lead to physical debility.
By 2030, the American Heart Association estimates more than 8 million people in the United States, 1 in every 33, will have heart failure. Dr. Sinfield says sometimes the medications prescribed to treat heart failure aren't successful.
Some people, even despite taking appropriate dosages of their medicine, still struggle with the symptoms of heart failure.
A new device is helping patients experiencing heart failure live more comfortably.
So this device is called the CCM device, which stands for cardiac contractility modulation. So it is a pacemaker-like device, although it is not a pacemaker because it doesn't actually pace the heart.
Here's how it works.
There's 2 leads that are connected inside of this device. You would implant it under the skin right about here or on this side of the chest as well, okay? And the leads will go into a vein that goes into the heart, and we put 2 leads into the lower chamber of the heart that deliver the high voltage impulses to hopefully increase the heart function.
Dr. Sinfield says some patients who were once bedridden are returning to their daily activities with this new technology.
And there's been 3 or 4 high-quality clinical trials, and it's gained FDA approval. And then the trials have demonstrated about an 80% response rate.
As the leaves begin to change during the fall and winter months, doctors say their attention turns to flu season.
We see the most activity beginning in October all the way through the end of May, and with a peak between the months of December and February.
Irene Pena is the clinical nurse lead at Bon Secours' Wellness Outreach Program. She tells us some of the more common symptoms of influenza include fever, chills, body aches, sore throat, and headaches. But before you're forced to take a sick day, health experts are offering several reminders to help dodge the illness.
So in order to prepare for the flu season, the #1 recommendation by CDC is that people receive the annual flu vaccine. CDC recommends that individuals 6 months and older without any contraindications to the vaccine receive the vaccine.
For those who are 6 months and older, the CDC says the latest immunization is one of the best ways to reduce your risk of contracting influenza.
This year, the flu vaccines that will be used in the United States will be the trivalent vaccine. That means that all of these vaccines will protect people against 3 types of flu virus. That is 2 types A and 1 type B.
More than 44,000 people died from flu complications last season, according to the CDC. Other than the vaccine, doctors say you can prevent the spread of germs by avoiding people who are sick, covering your cough, and washing your hands. Health experts also recommend cleaning frequently touched surfaces and practicing good health habits such as getting enough sleep, drinking plenty of fluids, staying active, and eating a balanced diet. While contracting the flu is at times unavoidable, doctors say to pay close attention to your symptoms.
You definitely should seek medical attention if you experience any of the flu symptoms, but they're unusually severe, particularly if you experience difficulty breathing, feeling faint, a severe sore throat.
Health experts recommend seeing a doctor if your symptoms worsen or if you're considered to be at high risk, including women who are in their 2nd or 3rd trimesters of pregnancy, people over the age of 65, and those with other chronic medical conditions. For this week's Ask the Expert, I'm Kelsey O'Donnell.
1 in 2 people will be diagnosed with some form of cancer in their lifetime.
With 20-plus years of experience in the medical field, Dana Laird says cancer research has evolved through the years with troubling trends.
It's the leading cause of death worldwide.
According to the American Cancer Society, the past 3 decades have shown a steady decline in cancer-related deaths. However, the number of people diagnosed is trending up.
It's not just the older crowd either. I mean, we're seeing 30-year-olds coming in with metastatic cancers.
Health experts say the diagnoses are due in part to advancements in medical technology, many of which aid in early detection.
Some cancers can be curable or put into remission if it's caught early enough. If people sit on signs or don't seek treatment for some warning signs, it can progress and spread.
The key, doctors say, is catching cancer in its early stages, and in many cases, symptoms are ignored or even go unnoticed.
It depends on the type of cancer, but things people need to look for are any unusual lumps or bumps on their body that don't typically belong there, any skin changes or unusual rashes, unexplained bleeding from your gums, dark, tarry black stools, unexplained fevers, night sweats, unexplained weight loss. There's a lot of signs of cancer out there.
With more than 100 types of cancer, health experts say symptoms can vary, which is why it's important to stay on top of your health. The earlier you know, the quicker you can begin treatment, which could increase your chance of making a full recovery.
Treatment is determined by what type of cancer you have and what stage it is. Certain treatments may just be surgery to remove the cancer. Other treatments may include chemotherapy, immunotherapy, or even radiation. I highly recommend to people that if you notice something unusual that should not be there, like I said, unexplained bleeding, bruising, anything abnormal, the best thing to do is go to a doctor to be seen and get checked out, because if you don't, you just ignore it. It's a decision between life and death.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Remember, you can find all of these stories on our website, WSPA.com. Just click on the Ask the Experts section. Right now, we're going to take a quick break and return with answers to more of your medical questions. We want to continue now with a look at doctors and health experts answering your questions. This is 7 News Ask the Expert in partnership with Bon Secours St. Francis. It's no surprise that as our age grows, so does the list of aches and pains.
Most adults will experience an episode of neck pain throughout their life, but the good news is that the majority of cases will resolve on their own.
Orthopedic spine surgeon Dr. James Whaley says there are a number of reasons for neck pain and stiffness, including poor posture, arthritis, muscle and ligament issues, or injury. However, he says most can be treated with anti-inflammatories or a specialized stretching program.
These are usually self-limited, meaning that they'll get better with time. However, some people may require treatment that involves physical therapy or even injection therapy.
Doctors say more serious cases could require surgery and have a lasting impact on your lifestyle, which is why experts say you shouldn't ignore how you're feeling.
If you have symptoms such as numbness or tingling in your arms or legs.
He says those symptoms could be a sign of a more severe problem. Dr. Whaley says it's also important to seek help immediately if you're in an accident.
You should seek medical attention or go see your doctor anytime you're involved in a traumatic event that causes neck pain, whether that be a diving accident, a sports accident, if you fall, or if you're in an automobile accident.
Severe headaches and a fever accompanying neck pain are also reasons to see a doctor. For this week's Ask the Expert, I'm Kelsey O'Donnell.
Arthritis affects about 1 in 5 adults in the U.S., according to the Centers for Disease Control and Prevention. So chances are you know someone who has it, or maybe you're impacted by it yourself.
Arthritis is a very broad term. Simply put, it's joint damage or joint damage over time.
Dr. Mona Idris, a rheumatologist with Bon Secours St. Francis, calls the most common type of arthritis wear and tear arthritis.
You do not expect it in a 5-year-old. but you do expect it in a 50-year-old. You certainly expect it in a 75-year-old.
And then there's the more serious inflammatory arthritis.
There's not supposed to be inflammation in your joint, just like in your life. You're not supposed to have inflammation. Anywhere you see inflammation, bad news. So if you have inflammation in your joint, that's not normal.
Inflammatory arthritis can have many causes, including rheumatoid arthritis, lupus, and gout, making it a strong indicator that your body is fighting another illness.
Much of this inflammation is driven by an immune response, so it's not just limited to the joint.
Treating this type of arthritis is very involved.
Those require drugs that are immunosuppressive, so they will be chemo drugs, and they're far more serious and they're managed very closely.
Meanwhile, doctors say normal wear and tear arthritis is more easily treatable.
Creams, topical therapies, patches, this is something you can do for an indefinite period of time.
Dr. Idris says you can take over-the-counter pain medicines like ibuprofen and acetaminophen to manage the pain. She also recommends physical therapy and says prevention is key. Daily exercise, maintaining a moderate weight, and a low-fat, anti-inflammatory diet can help.
Cutting down on processed foods, cutting down on something you stick in the microwave for 2 minutes before you consume it.
And by the way, if you were wondering about that old wives' tale, Dr. Idris says no. Knuckle cracking will not cause arthritis. For this week's Ask the Expert.
The better you sleep, the better your overall health.
Kristen White has been a doctor of physical therapy for half a decade, helping patients better their sleep posture.
Sleeping posture is super important because if you're trying to sleep in a position that's uncomfortable or that can cause pain, it can impede your rest. And we all know that sleep is very important for healing and for energy levels and for our daily life.
Doctors say there are a number of factors that can lead to an uncomfortable wake-up call, including the position you rest.
The main goal with sleeping is that your spine is in a neutral position, a position that doesn't put strain on certain muscles or on certain joints.
According to health experts, the strain is often the outcome of contorting your body into various positions or caused by improper support. Doctors recommend using pillows to bolster your neck, back, and knees.
You want to make sure that you pull the pillows up as far as they'll go. So Jessica, if you grab the tail ends of those pillows and just pull them all the way up, yep, and then rest your knees like this. What this accomplishes is it flattens her lumbar spine, it decreases the arch in her back, so that helps there not be any stress on her lumbar spine.
White says lying on your back or your side are two of the best options. However, there is a third popular sleeping position she's not thrilled with.
It's very difficult to keep your neck in neutral alignment when you're on your stomach. Typically, the head will rotate left or right. This is going to put a lot of strain on one side of her neck. So this is one reason I don't recommend lying on the stomach.
Sleep specialists say choosing proper pillows and a mattress that is right for you can also help. As for where to start, doctors say somewhere between soft and firm. That's a decision left up to you and your comfort level. For this week's Ask the Expert, I'm Kelsey O'Donnell. Don't forget to submit a health topic to our Ask the Expert series. Go to our website, click the news tab, and look for Ask the Expert. It's simple. More of your questions answered by our Bon Secours St. Francis medical experts after this. Welcome back as we continue to get answers to your various health topics. We continue now with our partners at Bon Secours St. Francis. This is 7 News' Ask the Expert. Whether you've had children, are aging, or live an active lifestyle, doctors say your pelvic floor muscles are essential to your overall well-being.
Your pelvic floor is basically just a group of muscles at the floor of your pelvis, hence the name. So that's the red on this model. It's going to run all the way from the front at the pubic bone to the back at the tailbone, and then around to the hips on the sides as well.
Bon Secours physical therapist Julia Skelton explains the pelvic floor is a group of muscles that supports the bladder, bowel, and in women, the uterus. But women aren't the only ones who can experience changes.
Men can be affected similarly as women. They have obviously different anatomy, so that can present a little bit differently, but they can still experience urinary or fecal incontinence. They can experience constipation, pelvic pain.
Doctors say pelvic floor dysfunction can be triggered by prostate surgery, pregnancy, childbirth, or even lifestyle factors like chronic constipation or heavy lifting.
What we'll see clinically is going to be some type of leakage, so bowel or bladder leakage of some kind, urinary retention or an inability to empty the bladder, constipation, pelvic pain, and pelvic organ prolapse as well.
That's where therapy comes in.
So I think oftentimes the narrative out there for the public is just do your Kegels, which hopefully that's changing a little bit. Kegels have a place, but they are not applicable for everybody. They're not a one-size-fits-all kind of exercise. And so for just general advice, weakness is not maybe always the issue.
Skelton says trained professionals can help you determine what your body needs.
So you need that full range of motion, just like you would need your bicep to be able to flex and extend your arm for a full functional use of your arm. You want your pelvic floor to be able to engage and relax fully as well.
According to medical professionals, physical therapy is also useful during pregnancy and helpful in postpartum recovery.
We're taking you through some mobility exercises, through manual therapy techniques, working on your tolerance to activity, just making sure that you can be as functional as possible with as little pain as possible.
Doctors say you shouldn't be embarrassed about pelvic floor issues. Getting help can make all the difference. For this week's Ask the Expert, I'm Kelsey O'Donnell.
Occupational medicine is here to safeguard the health and safety of workers in manufacturing across all industries. Obviously, the first thing that comes to mind is treating injuries and illnesses.
Dr. Jim Oliver, Medical Director of Bon Secours Occupational Medicine, formerly known as WorkWell, is a part of a team of health experts who treat and protect patients with work-related injuries or illnesses. Their goal, he says, is to create a plan to recover from and prevent things like lacerations, broken bones, and chemical exposures.
But we do significantly more than that.
Dr. Oliver says occupational health and medicine is more than just treating those injuries and illnesses.
Our responsibility is to understand OSHA requirements, DOT requirements, FMCSA requirements, and we help our client companies comply with those regulations.
Occupational medicine experts in many cases work directly with companies to assure employees on the job are safe and healthy.
We help our companies evaluate the work site and the workstation and offer suggestions on how to minimize the risk.
Doctors say they also help administer company-mandated drug screenings like those required for the Department of Transportation, school bus drivers, and individuals entering the military.
Once an injury happens, we usually see them here. We typically try to stick with conservative care when that's possible. We back off on their physical labor and allow them to stay at work and be active while they're recovering, use over-the-counter medications, and basically we try to get out of the way of Mother Nature, let Mother Nature do her job.
Health experts say injuries and illnesses can happen anywhere at any time, which is why it's important to focus on prevention to lessen the risk of an emergency.
Job rotation is a big start. Taking frequent breaks when you're working a very physically demanding job. Using protective gear, goggles, safety glasses, masks, gloves, aprons to prevent exposure to what is in the workplace.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
A lot of times these supplements are used for immune boosting, anti-inflammatory, or digestive issues.
Bon Secours dietitian Lauren Hill is breaking down the benefits of turmeric, zinc, elderberry, and ginger, which have become increasingly popular in health and wellness.
So elderberry usually is used for decreasing some symptoms that you might have with, colds, flus, anything of that nature. It's kind of an immune boosting supplement. Most of them, ginger and turmeric and zinc as well, but ginger will oftentimes help with digestive issues, and then turmeric is oftentimes used for anti-inflammatory.
Health experts say these supplements are commonly consumed in a balanced diet, but they can also be taken as supplements.
If you decide that you do want to take a supplement, it's going to be kind of up to the consumer and what your preference is, both with pills or powders.
While consuming turmeric, elderberry, zinc, and ginger can provide many benefits, health experts caution against overconsumption and warn of potential interactions with other medications or underlying conditions. That's why it's important to consult with a doctor before adding supplements to your routine.
Always best to go to your doctor. Again, when you're deciding to start a new supplement, especially if you are immunocompromised, if you take certain medications, if you have underlying conditions, I would always make sure you consult with your doctor before starting a supplement to make sure that they don't interact with anything you're currently taking.
And while many supplements have been scientifically proven to enhance well-being, dietitians say the best way to fuel your body is with proper nutrition through a healthy, well-rounded diet.
I think as a general rule, supplementations can be super beneficial for individuals, but also making sure that you're getting foods naturally through our diet is always the best route to take.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Getting your body ready for pregnancy may look different for each person, according to health experts with the CDC.
So, general time frame is pretty individual. Most women start thinking about planning a pregnancy in their mid-20s. That's about the average, but we take care of pregnant women in their 20s, 30s, and even 40s.
Dr. Celeste Beaudoin, an OBGYN at Carolina's Women's Health, works directly with families for pregnancy planning.
As far as how long it can take to become pregnant, well, some couples it can take even up to a year.
Which is why she says it's important to start the planning process sooner rather than later, and that begins with seeing a doctor.
So coming in before you're thinking about starting the process is a good idea, just to make sure that you're not on any medicines that would hinder or be unsafe in pregnancy, and see if there's any health conditions that we can make sure that you're healthier with before starting.
Doctors say the mother's overall health is one of the most important parts of pregnancy. According to the CDC, smoking and drinking alcohol can cause issues, including birth defects, premature birth, and in worst cases, death. To ensure mom and baby get the proper nutrients, doctors recommend starting a vitamin.
It's always a good idea to be on prenatal vitamins before you start trying to get pregnant. At least a month is ideal. And so I usually tell women if they're going to stop their birth control, start taking a prenatal at least a month earlier than that. So making sure you're on one that has enough folic acid, at least 400 micrograms, sometimes more depending on your health, is a good idea.
Nutrition is not the only thing that mom should plan for ahead of pregnancy. Medical professionals say you should also keep an eye on your weight and prioritize moving your body.
So it's something that everybody has to talk about every time they come in, but at least having 30 minutes of exercise 5 times a week, somewhere between 150 to 200 minutes of exercise. If you can get in a regular routine of that and maintain a healthy weight while you're trying to get pregnant, then your pregnancy is going to go a lot smoother.
Overall health before pregnancy encompasses many things, even areas many tend to forget.
One thing that not everybody really thinks about is their dental health. And so not just seeing your doctor, but seeing a dentist and seeing if there's things that you can take care of, because we know that poor dental health contributes to a very high risk of preterm labor.
Whether you're pregnant or planning to grow your family soon, doctors say it's never too late to get back on track to prioritize your health for you and your baby. For this week's Ask the Expert, I'm Kelsey O'Donnell. That's a wrap on this week's Ask the Expert show here on WSPA Plus. Join us every Thursday on 7 News as we seek answers to your top health questions, and each week right here on WSPA Plus. For now, thank you for making an appointment with us today.